Hi, my name is Penny Hutchins, and I chose the bill titled Youth Mental Health Research Act. The bill was introduced to the House of Representatives on April 1st, 2025, in the first session of the 119th Congress. The bill H.R. 2587 stated, to establish a youth mental health research initiative in the National Institutes of Health for purposes of encouraging collaborative research to improve youth mental health. The short title to this bill is cited as Youth Mental Health Research Act. Congresswoman Bonnie Watson Coleman introduced this bill along with Congressman Mr. Keene and Mr. Fitzpatrick. The bill was then introduced to the Senate on April 2, 2025 in the first session of the 119th Congress. The bill S-1266, with the same bill name, was introduced by Representative Ms. Klobuchar and Mrs. Britt. It was then referred to the Committee on Health, Education, Labor, and Pensions. There has been a growing concern in our youth's mental health. There has been a significant increase in the youth mental health illnesses over the past few years. However, it's becoming a crisis in the United States. Since the recent COVID pandemic, there has been a rise in suicide and suicide attempts among Black children than white children. The need to reduce disparities and provide improved interventions, treatments, and better access to the healthcare services is crucial. If the bill Youth Mental Health Research Act pass, the results will present effective ways to help our youth, families, and communities. The National Institute of Mental Health developed 4 goals. The first goal was used to mapping brain circuits and how brain functions are altered when one has developed mental health. Using new technologies, they zone in on how the different types of neurons and glial cells are involved in complex behaviors with mental illnesses. The second goal was to look at social determinants and the environment affecting mental health with assessment tools, treating illnesses, and improve outcomes. The development of aging trajectories to find critical time points, also known as sensitive periods, is one's life could intervene and or prevent mental illnesses. The third goal would be to create improved interventions for prevention and treatment plans. This may include therapeutic treatments with pharmaceuticals, cognitive behavioral therapies, and or experimental therapies. The fourth goal is to strengthen mental health services by increasing access to services and evidence-based interventions, and to improve recovery outcomes as well. The goal may include further research on innovative designs, methods, measures of the population on the effects of youth mental health issues. Middle and high schools often present challenging transformations for many students. If not the transition from elementary school to secondary school, it could be the difficulties with families at home, peer pressure, and stress with academics or after-school activities. Students report to having feelings of stress, anxiety, depression, self-harm, suicidal ideations, or suicide attempts, especially among the lesbian, gay, bisexual, transgender, queer, or questioning adolescents. There are also shortages of mental health professionals and funding issues that affect students who need interventions. However, if schools take part in expanding mental health services, increase mental health screenings, and provide education on mental health, it may result in reduction in the mental health illnesses. There is a significant increase in suicide rates in rural areas compared to urban areas of the country. In rural areas, children may have more of an access to lethal weapons such as firearms and knives. Disparities in racism, increased mental health stigma, and shortages on health and mental health providers. Addressing the issues of shortages on providers would help give children services needed to reduce mental illness. Schools should have protocols in place to provide interventions, treatments, and programs such as suicide prevention programs, and have school nurse contribute more to prevention and identification of mental health issues. And here you see the youth populations being affected. In social determinants of health, whether it be rural areas or poor living environmental conditions, there is much to consider about youth mental health. Does a child have any social issues with having peers or someone to talk to at school? Where they live, do they interact with anyone around them? How is the family's economic status? Who is the provider at home? How many people live in the home? Is it a single parent or guardian taking care of a child or children? Is Congress involved in making a difference in mental health among the youth? Are there policies or laws already in place to aid mental health issues? What about ethic considerations, including providing help, providing care, treatment, interventions, and providing comfort? Is someone advocating on behalf of youth with mental health issues? There is much more to consider and questions to ask when it comes to addressing social, economic, political, and ethical issues toward mental health. To develop a bill concerning youth mental health issues and to do research with organizations, associations that supports the youth mental health bill, it opens the opportunity to delve into the mental health problems and find solutions that would greatly impact social, have funding resources, political, and ethical aspects of mental health. When it comes to youth mental health, school nurses are in a pivotal position to find and intervene with a student who has mental health issues. As healthcare professionals, school nurses are at the forefront in medical, mental, and behavioral health issues. School nurses collaborate with social workers, school counselors, school psychologists to get the help students need to improve their outcomes on their mental health. School nurses connect with families to provide a list of resources in the community and at school. There was a project designed in 2017 by the Health Service Department implementing the Multi-Tier System of Support (MTSS) framework, which is an evidence-based framework to prevent and integrate problem solving so children can grow and learn, providing academic and behavioral interventions. And there are 3 tiers to the framework. Tier 1 intervention teaches awareness and skill of students' emotions and how their emotions contribute to their physical problems. They are provided with coping strategies to better regulate their emotions. Tier 2 interventions teach more targeted strategies, such as providing added support and coping skills for the students. Tier 3 interventions are more intense, individualized plans for the student to reach more specific goals. The American Nurses Association position statements and the Code of Ethics in Nursing are the foundational guidance for nurses in any healthcare setting. In relation to this bill of youth mental health, nurses establish a relationship of trust, provides care, promotes health and wellness, addressing issues, assist in decision making with their parents and guardians, and provide support to their students they care for. Nurses are committed to providing nursing care and evidence-based education to the adolescents who have chronic conditions and mental health issues, so they can understand and use intervention strategies for their health issues, connect more with their families and in their communities. Nurses will advocate for the students' rights, safety, improving health and nursing care. Nurses who are involved with legislation advocate for the needs and the safety of our students. Nurses are accountable for their practice and provide evidence-based care, preventing illnesses, and promoting health. Nurses are continuously learning and staying up to date on new interventions, disease, and treatments by attending meetings and conferences, therefore increasing their knowledge. Nurses have moral values they uphold, promoting dignity, respect, and compassionate care. Nurses are involved with ethical positions and boldly stand up for what is right for their students. Being a school nurse, I am a member of the National Association of School Nurses and the Virginia Association of School Nurses. Both associations are involved with political legislations and laws when it comes to health policies, as well as advocating for school nurses and students. Our main priorities are toward the students and to ensure they are healthy and ready to learn. I attend the meetings and conferences they have and further my education and knowledge in any latest information. Numerous professional organizations and associations exist for nurses. The one main organization, Association for Nurses, is the American Nurses Association. They develop the nursing provisions and code of ethics, which is pivotal to nurses. In Psalms 34, verse 18, states, "The Lord is near to those who have a broken heart, and saves such as have a contrite spirit." God is close to us and ready to provide comfort and support. Contrite refers to having a deep sense of remorse and humility before God. God will help those who are suffering with mental health illnesses. In one qualitative research, school nurses have barriers to their role to care for students. There are school principals, school counselors, and social workers who do not believe that school nurses should be part of the multidisciplinary teams. School nurses have knowledge of warning signs, a nursing intuition of red flags, but they do not have access to mental health screening tools. Once identification is made by the school nurse, they would collaborate with school counselors and social workers so they could further assess and refer students to mental health services to get the help they need. School nurses may only be consulted when students are receiving medication during the school day. The school nurses are treated as if they do not need to know the student's mental health issues. One participant in the research was told by their principal they needed to stay in their lane, only do medical care, not mental or behavioral health. In a quantitative research, the researcher studies parental mental illnesses and how they may affect children later in life. The most common mental illness is depression. The researchers measure parenting behaviors, the well-being, skills, competencies in parenting, self-esteem, and hope. Researchers study the outcomes of children, such as their cognitive functions, stress and trauma experiences, and coping skills. They suggested further research to focus on fathers, mental health literacy, impact of responsibilities, and assessing parents' past trauma. In another qualitative study, the study focused on youth being engaged as part of research. The problems of doing research studies are funding and resources. The researchers commented on how it may be difficult to recruit youth, develop trust, and how the youth may be hesitant about sharing the mental health issues prior to consenting to the study. In relation to the Youth Mental Health Act, it is important for researchers to provide as much information as possible so the youth and their parents will know what the study is about, what all is involved, incentives they may be able to provide the youth as rewards, payments, or recognition in the involvement of the research. The youth should not be placed under pressure or deceived, and an informed consent must be obtained after all questions have been answered. My personal recommendations are using quantitative and qualitative studies that would be related to the Youth Mental Health Research Act, and why it is important to have a research done to further assist underserved minority and racial groups and to have a positive outcomes for those with mental health issues. Thank you.